So I have just a bit of thought exercise for you in terms of clinical practice. And my caveat, of course, is that I'm not a clinician, but it is something that I strongly believe needs to be incorporated into clinical practice. If it's not already, we need to be thinking about environmental health and environmental exposures when patients are coming in with various health outcomes, especially for chronic disease where you could be providing suggestions and asking questions over time and incorporating it into the disease outcome solutions. This is supposed to say brainstorm, but just to think about, if I was doing a back and forth, a live presentation back and forth and getting questions and answers and having some discussion, I would ask you, and you can do this right now, but in geriatric clinical practice, how can environmental exposures be better assessed in patients? What can we do in order to really make sure that we're getting down to the root cause or root associations between exposures and outcomes? So asking them questions that I've covered. What is their environment like? Where do they live? What is their housing like? How old is their housing? What is their access to food? Do they drive? How close are they near a subway station or a bus station? At least thinking in New York City. What is their social environment? Do they have people who can help them? If there's a major climate event, if there's a major weather event, if they're flooded, who will help them and how will they get out of their home to get to safer shelter? This was a problem that actually happened with Hurricane Sandy, where people were trapped in their homes in large high-rises, and which are probably beneficial for many people because you have access to a lot of amenities when you're in a large building unit. However, with a flood, you may lose power, you may not be able to use an elevator, etc. So how can these people be helped? How can patients be helped both when they have chronic outcomes, but also to prevent acute and chronic outcomes? And I would propose we could use pediatric environmental health specialty units as a template or as a model to be thinking about how to do this, because this is already being done in pediatric populations. There's a national PEHSU. They have a health toolkit. It includes patient surveys, fact sheets, and webinars for clinicians. It's completely free. It's available online. And it's also user-friendly in terms of for the patients. So they can download onto their mobile devices, onto their computers. Their family members can also. And there's also free continuing education. And this is all developed from the Agency for Toxic Substances and Disease Registry, so ATSDR. There's the quality of life skill that could be used. As I mentioned, quality of life, what is happening in the older adult population? What is their material and physical well-being? These are all questions that could be asked. Their social environment, their relationships, their family. What makes them happy? Their personal development and fulfillment. Are they near a park? Remember green space? That's what everybody thinks is the environment. That's the first answer. What are their recreational potential in their neighborhood where they live? And how do they get to it? So I want to provide a few additional resources for some of the items that I've talked about. So ATSDR is available they're a part of the CDC, the federal government. The EPA, which I also mentioned, which started in the 1970s when a lot of regulation started to ramp up in terms of environmental exposures. The National Institute on Aging, of course, a wonderful resource, and they are starting to develop a lot of research with older adult populations and environmental exposures, as well as the NIEHS, or the National Institute of Environmental Health Sciences, which, of course, has a focus on research in environmental health. So hopefully you find these resources useful. And, of course, some acknowledgments. And that's it. Thank you.